Post-traumatic stress disorder, or PTSD, is a mental health condition that affects millions of people around the world. It can occur after experiencing or witnessing a traumatic event, such as war, violence, abuse, accidents, or natural disasters. People with PTSD may have nightmares, flashbacks, anxiety, depression, anger, guilt, or isolation. They may also have difficulty sleeping, concentrating, or relating to others. PTSD can interfere with their daily lives and well-being. But there is hope. PTSD can be treated with therapy, medication, or other methods. There are also ways to cope with the symptoms and triggers of PTSD. In this video, we will explore everything you need to know about PTSD, what causes it, how it affects the brain and body, how it can be diagnosed and treated, and how you can support yourself or someone you care about who has PTSD. We will also share some stories of people who have overcome PTSD and found healing and happiness. We hope this video will help you understand PTSD better and inspire you to seek help if you need it. Remember, you are not alone. You are not weak. You are not broken. You are a survivor. And you deserve to live a fulfilling and peaceful life. This is Spectrum of Wisdom, and this is our video about PTSD. Post-traumatic stress disorder, PTSD, is a profound mental health condition triggered by experiencing or witnessing deeply distressing events. This could range from personal assaults, warfare, accidents, to any threats to one's safety or life. The echoes of these traumatic events manifest as disturbing thoughts, dreams, or even physical distress. Individuals may find themselves constantly on edge, as if ready for a fight or flight. These symptoms persist for more than a month and can lead to an increased risk of suicide and self-harm. Interestingly, not everyone who goes through traumatic events develops PTSD. It's more prevalent among those who've experienced interpersonal violence like sexual assault, kidnapping, stalking, or domestic abuse. Long-term trauma exposure can lead to a more complex form of PTSD known as CPTSD, which profoundly impacts emotional regulation and self-identity. Prevention strategies are most effective when targeted at individuals showing early symptoms. The primary treatments include psychotherapy and medication, with SSRIs or SNRIs being the first-line medications. However, the benefits from medication are often less than those seen with counseling. In the United States, about 3.5% of adults have PTSD in a given year, and 9% develop it at some point in their life. Globally, the rates are between 0.5% and 1% per year, with higher rates in conflict zones. It's also more common in women than men. The understanding of trauma-related mental disorders dates back to the time of the ancient Greeks. There are historical instances of post-traumatic illness from the 17th and 18th centuries. During the World Wars, it was known by various terms like shell shock, war nerves, and combat neurosis. The term post-traumatic stress disorder was coined in the 1970s due to diagnoses of U.S. military veterans of the Vietnam War and was officially recognized by the American Psychiatric Association in 1980. Post-traumatic stress disorder, PTSD, is a complex mental health condition that often remains hidden beneath the surface. Symptoms typically emerge within 3 months of a traumatic event, but in some cases, they may not appear until years later. Individuals with PTSD often find themselves trapped in a cycle of avoidance, persistently steering clear of trauma-related thoughts and emotions, and may even experience amnesia of the event. Yet, the trauma often resurfaces through intrusive recollections, flashbacks, and nightmares. While it's common to have symptoms after any traumatic event, these must persist to a sufficient degree for longer than 1 month to be classified as PTSD. Interestingly, some individuals experience post-traumatic growth following a traumatic event. Survivors of trauma often find themselves grappling with depression, anxiety disorders, and mood disorders in addition to PTSD. Substance use disorders, such as alcohol use disorder, commonly co-occur with PTSD and can complicate recovery from PTSD or other anxiety disorders. PTSD has been linked with tinnitus and could possibly even be its cause. In children and adolescents, there's a strong association between emotional regulation difficulties and post-traumatic stress symptoms. Moral injury, the feeling of guilt or shame following a moral transgression, is associated with PTSD but is distinct from it. While PTSD is associated with anxiety and fear, moral injury is tied to feelings of shame and guilt. The spectrum of PTSD explores the experiences and insights of patients in life-threatening situations. Those considered at risk include combat military personnel, survivors of natural disasters, concentration camp survivors, survivors of violent crime, and individuals employed in occupations that expose them to violence or disasters. PTSD has been associated with a wide range of traumatic events. The risk of developing PTSD varies by trauma type and is highest following exposure to sexual violence. Men are more likely to experience a traumatic event, but women are more likely to experience high-impact traumatic events that can lead to PTSD. Survivors of motor vehicle collisions are at an increased risk of PTSD. Globally, about 2.6% of adults are diagnosed with PTSD following a non-life-threatening traffic accident. The risk almost doubles for life-threatening auto accidents. Females were more likely to be diagnosed with PTSD following a road traffic accident. Post-traumatic stress disorder, PTSD, is not just an adult affliction. It casts its shadow over children and adolescents too. While the rate of PTSD might be lower in children without therapy, these symptoms can persist for decades, turning childhood memories into haunting nightmares. In a non-war-torn, developed country, about 1% of children and adolescents may have PTSD compared to 1.5% to 3% of adults. On average, 16% of children exposed to a traumatic event develop PTSD, with the risk varying according to the type of exposure and gender. Childhood trauma, chronic adversity, neurobiological differences, and familial stresses are often predictors for PTSD in adulthood. The proximity to, duration of, and severity of the trauma can leave lasting impacts. Interpersonal traumas such as physical abuse, assault, or kidnapping can lead to a higher risk of developing PTSD. Domestic violence casts a long shadow, predisposing individuals to PTSD. Mothers who experience domestic violence during pregnancy may carry the burden of PTSD, affecting not just their lives but potentially influencing the next generation. Survivors of sexual assault or rape may find themselves trapped in a cycle of re-experiencing the assault, avoidance, numbness, and heightened anxiety. The likelihood of sustained symptoms is higher if the survivor was confined or restrained during the assault or if they were very young or very old at the time. Military service can also be a pathway to PTSD. While around 78% of people exposed to combat do not develop PTSD, for about 25% of military personnel who do develop PTSD, its onset is delayed. Refugees bear an increased risk for PTSD due to their exposure to war, hardships, and traumatic events. The rates for PTSD within refugee populations range from 4% to 86%. The challenges related to the overall psychosocial well-being of refugees are complex and individually nuanced. Refugees often grapple with reduced levels of well-being and high rates of mental distress due to past and ongoing trauma. In this journey through trauma and recovery, it's important to remember that every person's experience is unique. Understanding and empathy can go a long way in helping individuals navigate their path towards healing. The sudden, unexpected loss of a loved one is a deeply distressing event, and it's the most common traumatic event reported globally. However, the human spirit is resilient, and the majority of people who experience this type of event do not develop PTSD. According to the World Health Organization, there's a 5.2% risk of developing PTSD after learning of an unexpected death of a loved one. This type of event accounts for approximately 20% of PTSD cases worldwide. Medical conditions like cancer, heart attack, and stroke can also increase the risk of PTSD. For instance, about 22% of cancer survivors live with symptoms similar to PTSD. Hospitalization in an intensive care unit, ICU, can also be a trigger for PTSD. Some women may experience PTSD from their experiences related to breast cancer and mastectomy. The loved ones of those who experience life-threatening illnesses are also at risk for developing PTSD, such as parents of a child with chronic illnesses. Survivors of psychotic episodes, such as those experienced in schizophrenia, schizoaffective disorder, bipolar I disorder, and others, are at greater risk for PTSD due to the experiences one may have during and after psychosis. The incidence of PTSD in survivors of psychosis may range from 11% to as high as 67%. Women who experience miscarriage are at risk of PTSD. Those who experience subsequent miscarriages have an increased risk of PTSD compared to those experiencing only one. PTSD can also occur after childbirth, and the risk increases if a woman has experienced trauma prior to the pregnancy. There's evidence that susceptibility to PTSD is hereditary, with approximately 30% of the variance in PTSD caused by genetics alone. For twin pairs exposed to combat in Vietnam, having an identical twin with PTSD was associated with an increased risk of the co-twins having PTSD. Several biological indicators have been identified that are related to later PTSD development. Heightened startle responses and a smaller hippocampal volume have been identified as possible biomarkers for heightened risk of developing PTSD. In this journey through trauma and recovery, it's important to remember that every person's experience is unique. Understanding and empathy can go a long way in helping individuals navigate their path towards healing. In the quest to alleviate the symptoms of post-traumatic stress disorder, PTSD, various therapeutic approaches and medications serve as potential lifelines. Social supports, for instance, play a crucial role. An open trial of interpersonal psychotherapy reported high rates of remission from PTSD symptoms without using exposure. Currently, a NIM-funded trial in New York City is comparing interpersonal psychotherapy, prolonged exposure therapy, and relaxation therapy. Despite these challenges, hope remains. A variety of treatments with greater efficacy for PTSD and fewer risks are available. These include prolonged exposure, cognitive processing therapy, eye movement desensitization and reprocessing, cognitive restructuring therapy, trauma-focused cognitive behavioral therapy, brief eclectic psychotherapy, narrative therapy, stress inoculation training, serotonergic antidepressants, adrenergic inhibitors, antipsychotics, and even anticonvulsants. In the journey towards healing from post-traumatic stress disorder, PTSD, physical activity can serve as a powerful ally. The U.S. National Center for PTSD advocates for moderate exercise as a means to distract from distressing emotions, bolster self-esteem, and foster feelings of control. However, they recommend a discussion with a doctor before embarking on an exercise program. For children, play can act as a bridge, linking their inner thoughts with the external world and connecting real experiences with abstract thought. Repetitive play can sometimes be a way for a child to relive traumatic events, which could be a symptom of trauma. While play therapy is commonly used, its effects are not yet fully understood due to the lack of comparative studies. In conclusion, while PTSD can be a challenging condition to navigate, there are numerous therapies, programs, and even technological innovations available that offer hope for recovery. Each person's journey is unique, but with the right support and treatment, healing is possible. Thank you for watching this video on post-traumatic stress disorder, PTSD. We hope you learned something new and useful about this condition. PTSD is a serious mental health issue that affects millions of people around the world. It can cause severe distress, anxiety, depression, and other symptoms that interfere with daily life. If you or someone you know is suffering from PTSD, please seek professional help as soon as possible. There are effective treatments and therapies available that can help you cope and recover from your trauma. You are not alone, and you deserve to heal. We are Spectrum of Wisdom, a YouTube channel dedicated to exploring various topics. We aim to provide informative and engaging content that can help you understand yourself and others better. If you enjoyed this video, please like, share, and subscribe to our channel. You can also follow us on our social media platforms for more updates and insights. Thank you for your support, and we hope to see you again in our next video. Stay safe and healthy.